Are you dealing with a stiff and painful shoulder that's preventing you from brushing your hair or sleeping well at night? You may be dealing with frozen shoulder. I am Dr. Sebastian.
And I'm Floyd, the PA working here at Integrative Rehab Medicine.
Today we're going to talk about frozen shoulder, or also known as adhesive capsulitis. So, what is frozen shoulder?
So frozen shoulder is a term that we use when the capsule of the ball and socket joint gets tight and inflamed, and that limits someone's range of motion.
Okay, so what can actually cause the capsule to get tight around the ball?
So it most commonly happens in women that are going through menopause. So there is some hormonal effects. It can also be different types of injuries that can cause that brief amount of inflammation, and that's what tightens it up.
Okay, so basically, frozen shoulder happens when someone either has an injury or maybe dealing with some hormonal imbalances, and the capsule becomes inflamed and tightens around the ball because this is a ball and socket joint. Okay, so what are the symptoms of frozen shoulder?
The main symptom is going to be loss of your range of motion. So someone that was previously able to lift their arm up over their head now cannot do that. And it seems to limit it in pretty much every range of motion. So forward, backward, and then also to the side.
Okay, and besides the loss of range of motion, there's a lot of pain. People experience a lot of pain at night or a lot of pain when they're trying to lift groceries or play with their kids. And the shoulder may also feel weak. So what do we do to diagnose a frozen shoulder?
The most important thing when you're diagnosing a frozen shoulder is doing a good physical examination, so checking the person's range of motion, and then we need to evaluate them further. We need to get some x-rays and make sure that we're not dealing with arthritis, because severe osteoarthritis or bone-on-bone osteoarthritis could also be causing that loss of range of motion. But if you have a patient that they don't have arthritis and they have the limited range of motion, then typically we would be diagnosing them with a frozen shoulder.
And sometimes MRIs or ultrasound scans can also identify frozen shoulder. They can see if there's thickening of the capsule or other signs can be identified as well. So, once we diagnose the frozen shoulder, what are some of the treatments that we can offer to our patients?
So the main way that we treat frozen shoulder is with something called a capsular distension. So as we described, it's the ball and socket. You have a capsule that's surrounding that. So we can inject in that capsule using ultrasound guidance, and we can put a high volume of fluid in there and put some numbing medicine in there. And then we have that person go work with our physical therapist immediately afterwards. So that's the most common way that we're going to be treating this. If there are other injuries like rotator cuff tears or tendinitis, then we can also use things like PRP, which is platelet-rich plasma. So those are going to be the ways that we're going to be managing this condition here.
Okay, so that makes sense. So someone who has a frozen shoulder and the capsule is contracted, we can go in and put a little needle into the capsule, put some high volume into the capsule, stretch the capsule, and potentially put some numbing agent and then move it around. And that could potentially cure the frozen shoulder. So the patient doesn't have to wait the 6 months or a whole year for the thawing of it. We can actually break this cycle and help them eliminate the symptoms, hopefully within how long does it take after a treatment?
So typically it's pretty fast after the treatment, but it can take a couple of rounds. Sometimes we have to do a couple of treatments. Usually we do them about once a week, and sometimes it can take between 2 and 3 treatments. But that's still, we're talking 3 weeks versus the typical thawing time, which is 6 months to a year. So this is a very accelerated process.
Excellent. So if you're dealing with frozen shoulder and you don't want to wait 6 months or a year for the thawing process, consider doing some capsular distension and maybe some PRP. If you want to find out more, just follow the link below and visit our website.